You know the drill, right? You need to see a doctor, so you schedule an appointment weeks out, you show up early for the paperwork, you wait, and then you wait some more in the exam room. And for what? Maybe 5 minutes with the actual doctor? We all just accept this as normal. But what if I told you it doesn't have to be that way at all?
No, really, just think about that for a second. The entire visit, from the moment you walk in the clinic door to the moment you walk out, prescription in hand, all in less time than it takes to get a pizza delivered. It sounds totally impossible, right? Well, in South Korea, this isn't some futuristic dream. It's just a regular doctor's visit. So the question is, how on earth do they pull that off?
I mean, look at this. The difference is just night and day. On one side, you've got this long, winding journey we're all so familiar with. It's a whole process. But then you look at the Korean experience, and it's this incredibly straight line. Walk in, see the doc, pay, and you're out. It's so simple. So what's the magic trick? What's going on behind the curtain that makes this incredible speed possible? Well, it turns out it's not just one thing. It's actually a combination of 4 key ingredients that are baked right into the system itself. So let's decode this thing. Let's look at the recipe for this kind of high-speed healthcare. Okay, here we go. First up, direct specialist access. A lot of the time, you don't need a referral. Got a skin thing, go right to the dermatologist. Easy. Second, high clinic density. There are just so many clinics everywhere, you can usually find one right in your neighborhood. Third, and this one is huge, invisible admin. Almost all of the bureaucratic stuff, the paperwork, it happens completely out of your sight. And finally, shared expectations. Everyone, the doctors, the staff, the patients, everyone expects it to be fast. It's the cultural norm. But, there's always a catch. This kind of incredible pace doesn't just happen for free. The whole system is optimized for speed, and that means there are some pretty big trade-offs. And honestly, they can be really jarring if you're not prepared for them. For example, that speed means you're likely going to get much shorter, to-the-point explanations from the doctor. There's just not a lot of time built in for long chats or a ton of questions. Now, if you're coming from a different system, that can feel really abrupt, maybe even a little dismissive. It creates this really steep learning curve, especially if you need that extra reassurance or time to process things. See? Efficiency has its price. So, okay, we've looked at how it works and what the downsides are. But to really get what's going on, we have to dig a little deeper. There's a core concept here that explains not just what happens, but how the whole experience feels so different. And that core concept is this: system friction. You can think of it like all the invisible gunk clogging up the gears. It's the paperwork, the waiting around, the phone calls, the approvals, all the bureaucratic hoops you have to jump through. It's not the actual medical care, it's everything you have to endure just to get to the care. And this iceberg is the perfect way to picture it. In a lot of healthcare systems, the admin part we actually see, like the clipboard at the front desk, that's just the tiny tip. The real problem, the thing that causes all the delays, is the massive, hidden chunk of invisible friction underneath. What the Korean system does so well is it doesn't get rid of the iceberg, it just hides most of it from you, the patient. And this right here is the key takeaway. It's so important. When someone says the care feels better, a huge part of what they're actually describing isn't the clinical outcome. It's the experience of having less visible friction. The whole process just feels smoother, simpler, and way more respectful of your time. This really nails it, doesn't it? Our whole feeling about a trip to the doctor is shaped way before we even say hello to them. All that frustration from trying to book the appointment, the anxiety you feel sitting in the waiting room, it all colors your perception of the entire visit. When you remove that friction, the whole encounter just starts on a completely different, much better note. So once you understand this idea of friction, it suddenly becomes clear why talking about healthcare across different cultures can get so messy and frustrating. It's usually not about one system being good and another being bad. It's about a fundamental clash of expectations. That's really what it boils down to. It's an expectation mismatch. So if you go in expecting a 20-minute, in-depth conversation and you get a super efficient 3-minute diagnosis, you might walk out feeling like you were rushed. But if you expect to be in and out in 10 minutes and instead you're stuck filling out forms, the system feels totally broken. The medical care itself could be identical in both cases, but the experience feels completely different because of what you expected. And that's exactly why trying to compare healthcare systems one-to-one is so often like comparing apples to oranges. It gets really sloppy really fast. The cultural norms, what a clinic even means, what patients expect, it's all so different.
that we're often not even talking about the same thing.
So let me leave you with this question to think about. This whole idea of invisible friction goes way beyond healthcare. Think about it. Getting a new passport, dealing with your bank, even just ordering something online. Where else in your life have you had an experience that just felt amazing? Not because the thing you got was so different, but because the process was just effortless. It's a really powerful way to look at the world around us.